This is a short introduction into changes in the student assessment ongoing achievement record. So here's the overview of the changes we're bringing in for you at the start of your next year. Mentors will be assessing the domains rather than the individual competencies. Each domain will be assessed in all placements to the expected level of programme review for a Year 3 student. We require 3 forms of evidence for each domain. A percentage grade will be awarded for each placement and for the final year. Your evidence will be expected to store as the same as you do currently. So let's have a look in more detail. So the 4 domains the NMC expect you to attain to graduate already have been assessed in practice, but in small component competency parts. So they are the professional values, communication and interpersonal skills, nursing practice and decision making, leadership, management and team working. Each of these 4 domains will be assessed in each of your 2 placements. You're going to be required to provide 3 forms of evidence for each domain. So that's 12 forms of evidence for each placement. As always, direct observation. The second piece will be a reflection and referenced related to the 3rd form of evidence. So here we have questioning and oral written, reports and statements for others, which often at the moment you reflect on, simulation, evidence of your work, and we're introducing service user reports. So the service user reports you give, you could write a reflection on this, and also any wide patient engagement activity that you undertake. So reflecting on one or more of the other forms of evidence that you produce, you are going to pull together something that you have undertaken and provided evidence for, and reflected on it and reflected on your learning and development from undertaking whatever it is that you have done. As now practice is graded 1, however we are changing from a 1 to 6 to a 0 to 100%, which reflects the knowledge and values pertinent to your stage of the programme, and you should demonstrate these in the practice area with the evidence that you collect. We'll have a look at the grading tool in a moment. As always, you require to achieve 40% for each domain. If you get less than 40%, then you can retake the domain in your second placement. If it is your last placement, then as normal, an extra period of practice will be required in order for you to attain. As always, 2 attempts at practice are required, so if you don't pass the domain, then the second time you do it will be your second attempt. So let's have a look at the grade, the level of performance that is expected. So these 2 areas are not so good, which actually are referral. Here are your 40% areas, and so on. So we're asking mentors to look at the guidance and to think about the domain and to see where they feel you sit as students. We're asking them to choose something either from the lower, middle or upper end of the spectrum. The aim to do this is that we would see you developing and increasing your score as the year continues. So what you achieve in placement 1, you should work towards building on it to get a higher grade in placement 2. Let's have a look at the domains. Here's professional values. Have a look at this and see where you feel you might be. So this is guidance. We're asking the mentor to look at all of these aspects and to come up with an overall score for the domain. Let's have a look at the next one. Communication and interpersonal skills. And again, the mentor is expected to grade you as an overall in this area. Nursing, practice and decision making has got more in it than the others. And here we are looking at here is where it's relevant then it's about medicines management, IV fluids, and recognise responding to change of patients. So it is acknowledged that you won't actually come across these particular elements in all placements. So this allows some leeway here. Leadership and management. You've got to get there, you've got to do it, and you've got to achieve this. This brings you up in line to being judged as a registered nurse in waiting. You have to demonstrate that you can meet these guidelines in year 3. As always, we have a development plan, how you're going to achieve the domain. Is there anything additional about the placement that could be set as objectives depending on the area that you're going to be going to, and how you're going to achieve those. Fairly straightforward. Your formative assessment, we're asking you to self-evaluate yourself on a score of 0 to 100 using the guidance, and then the mentor's assessment. And from that you can develop an action plan, areas that can be improved. When it comes to your summative assessment, the evidence is recorded and the grade for the domain is made for each of the 4 domains. There's a declaration for yourself and one for your mentors, and then what your personal tutor does is adds up the score, divides it by 4 to give an overall placement mark. Great. At the end you have a summative assessment form and confirmation, and this is similar to what you've been used to. This is an action plan. If there are anything particular you may have achieved, or if you haven't achieved, what is it you need to do and what action is required for you to take forward into the next placement. Whether you are referred or not, it's still important to identify areas that you need to work on and develop, and this is what this form is particularly for. So let's look at referrals. You have 2 attempts at practice. You attempt any of the referred domains, you do it in the next placement. If it's the end of the year, then we allocate a time period following the award board for you to retake the domain. The reassessment of that domain is classed as your 2nd attempt. I apologise for that, I'm just going to go back a bit. When you're reassessed, that mark will be capped at 40%. Again, this just reiterates that you may have to take an extended period of time if you're in your final placement and refer. This is a very short presentation. This will to support the discussion presentation I have in your preparation for year 3. There are a variety of people who can support you. We are doing a lot at the moment in training mentors, but please, if you or your mentors are in doubt and practice, you need to contact us to enable us to help you get the best out of placement and get their assessment right. Thank you for your time.